Hey, welcome back, and it's time for our Africa Health Network update, with health reporter Linord Moudou, who is here with information on improving sanitation in Mali, right?
Hello, Dimiake. Hello, everyone. Well, we have first an interesting story about the spread of malaria. It is transmitted to humans by the female mosquito, but now scientists at Yale University are focusing on the males. They are working on a new birth control drug for male mosquitoes that could slow the malaria epidemic. After mosquitoes are fed the inhibiting compound, the modified males, that is, sterile males, will be released to mate with wild females. With no resulting offspring, the population will be reduced without the use of pesticides. Now to Mali, where a new project has been introduced to bring clean water and improved sanitation facilities in schools to serve more than 500,000 children. The schools are equipped with water pumps, latrines, and hand-washing facilities. It is hoped that this will help in improving hygiene standards and behavioral change, not only for students, but also the communities they live in. 12-year-old Yusuf Dissa is a student at Njibugu School in Mali. He has taken a keen interest in the water and sanitation classes being held at his school.
At school, we have learned the importance of clean water and hygiene. We have learned that we have to wash our hands before we eat. We have learned about protecting water sources, how to prevent diseases. When I came home, I spoke to my grandfather and grandmother about it. It's great that children are able to share and transmit this important information and help our families. I think it's really important.
And Dissa's grandmother, Makura Sanogo, says knowing about hygiene and sanitation has made a positive impact.
Before, we had a lot of health problems here. We didn't know we needed to wash our hands with soap before eating. We just washed with plain water and were transmitting germs with our hands.
Experts say that unsafe sanitation and drinking water, together with poor hygiene, account for at least 7% of disease worldwide and about 20% of all child death in the world. While medical professionals have struggled for decades to develop ways to treat conditions like Down syndrome, autism, and partial paralysis, in Cuba, they have found that the most basic human expression, dance, is sometimes very effective. Ballet instructor Georgina Farinas has received help from psychologists and social workers to create this unique therapy.
We try to reintegrate them into the country's cultural life by teaching them dance, rhythm, and by broadening their cultural horizons. This makes them feel important and gives them better self-esteem. It makes them feel more valued by themselves, more valued by their parents, their teachers, and their communities.
The method, known as CUBA in Spanish, was officially recognized by Cuba's health ministry in 1977. It has since spread throughout Cuba and into other countries like Mexico and Spain. Farinas says it helps patients gain confidence and opens doors to other parts of society. Alida Esperanza Acosta's daughter, Lina, was born with infant paralysis. She is one of the beneficiaries of the program. Acosta says dance has been very good for Lina, who is now 23 years old.
The best treatment she's had from medications, therapy, and rehabilitation, because she's used to not walk, has been CUBA.
This dance studio at Havana's Africa House Cultural Center treats up to 20 patients simultaneously. But instructor Ophelia Bosch says the method itself is not enough.
You really have to do it with a lot of love and dedication. Only love can make a miracle.
The classes are free for people like 25-year-old Yudmila Torres Diaz, who has Down syndrome.
Ballet is a dream for me. I like it a lot, and I feel really happy and proud, and I've fallen in love with ballet.
CUBA, which includes salsa and other popular rhythms, is also being used with elderly patients to help them with balance and dementia. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website at africahealthnetwork.com. And Dimiake?
Excellent report, Linord. Thank you so much. Please be sure to watch Linord Moudou's Africa Health Network reports every Tuesday and Thursdays right here on In Focus.